Barbara.
I'm Cheryl.
And I'm Naima. We're three Black moms.
I don't remember it, but I'm told I had my first surgery when I was around 2 years old. It was to fix an umbilical hernia, and that surgery ended up being repeated many, many years later. And that's not the only surgery that I've had. I've had several. I've had one to fix a diverticulum on my esophagus. I've had myomectomy, which is the removal of fibroids. I had a scheduled cesarean section for the birth of my daughter. And the latest one, 3 weeks and 2 days ago, I had a hip replacement surgery. And yes, I'm actually doing quite well. So there are a lot of things with recovering from surgery that we want to talk about today. One is, with the exception of someone like our 100-year-old mother, who's never had a surgery, most people will have something done, or many people will have something done at some point in their lives. And you have to prepare yourself. Well, if you're 2 years old, obviously there's nothing I could do. But when you're an adult, for one thing, I would advise is to make sure you have an advocate. When you're getting this information, a lot of times you're rattled or you're not sure exactly what all the protocols are, what all the things to lead up to the surgery are going to be. So it's nice if you have someone to come with you to kind of help take notes. Also, if your surgeon or your surgical team will give you printouts of things, that will help you. Understand that usually the first 24 to 48 hours are the worst. Understand that when they say discomfort, they may mean pain. And because we are Black people, understand that some of your fears, concerns may be dismissed by someone who is a non-person of color. And that's been a problem for a long time. And we want to talk about that today, as well as the fact that several studies, and I'm going to read from them, have found that having a Black physician, even if you don't go to them, having one in your county improves health outlooks for Black patients. So I wanted to talk a little bit about that. But, first I want to say I'm doing great. My surgeon for my hip replacement, I was diagnosed with arthritis about 7 years ago, and it had gotten increasingly worse, and I was in chronic pain. And when I found this doctor, my Zumba teacher actually recommended me, recommended him and said, I don't know if this matters because she's a white woman, but he is African American. Yes, it mattered. Dr. James Phillips from New England Baptist is one of the best. He's, if not the best. I went in on a Friday at 5:15. I was home by 1:30. I used a walker for 2 days, maybe, just to get in and out of bed. By day 3, I was trying to use a cane, but I was actually walking faster than the cane. I haven't had to do any other mobile devices like walkers or crutches or even the cane. They send you to physical therapy the next day. When you leave the hospital, if you go like day surgery like I did, they make sure that you can walk and that you can do stairs. So these non-invasive procedures are different from the way they used to be. But I got to tell you, when I lay there in that bed, and I had great nurses, But when the doctor came in and there was another Black woman that was with him, I believe that she was a resident. And when it was just the three of us, I said, okay, can I say this? I am glad that it is us in here because I felt safe, I felt heard, and my recovery has been amazing for someone who is senior-ish and was told by people years younger than me who had the same procedure that I was going to be on crutches for 2 or 3 weeks. So, what do you think, ladies, about surgery and Black doctors?
Well,
I
yeah.
will have to speak to that because I think it is so important. You mentioned, Cheryl, about having an advocate in your corner when you are facing surgery. Now, as a young bride, I had gone in for a normal physical exam, and the doctor examined me, and the first prognosis to this young bride was I need to have a hysterectomy because I had such huge fibroids. What a horrible thing to say to a newly married woman with no children. And I had a friend who said, you need to get a second opinion. This is from Cook County. These people don't really care about you. So I got a second opinion. And then to make one up on all of that, after 7 different separate opinions in which I did not tell the previous doctor what had been diagnosed and told me before, they each one said the same thing, only worse, that I need to have a hysterectomy. But I have found a surgeon at Northwestern who really went to bat for me. And at first he was outraged that I was given, this prognosis. But then he said, after examining me, he said, well, we'll try to work on saving your uterus, but I give you a 10% chance of saving your uterus. What a despondent thing to hear, and we had friends all over that were praying for us. We went before the surgery, maybe a few weeks before the surgery. We went to a church in Yorba Linda, went to the Vineyard in California, and they said, is anyone here needing prayer for anything? I found myself stumbling forward. This really young guy, probably in his 20s, Blaine Smith, said, so what do I need to pray for you for? And I told him that I wasn't going to be able to have children. I had these huge fibroids, and he was pretty confident that that wasn't going to happen. He said, let me pray for you. Let me ask the Lord to touch you. And I just burst into tears saying, I don't think the Lord cares if I can have children or not. I was so embarrassed because I don't like crying in front of people, smile at all costs. But he prayed for me. I felt God's presence in an enormous way that was just hard to explain to anyone else afterward. And when we came out of surgery, Eric was leaning over me saying, oh, Barbara, they saved your uterus. They saved your uterus. Now, this was after the doctor said, you have a 10% chance of me being able to save your uterus. And I know that healing was in conjunction with this surgeon who cared about me. I knew it was from the Lord. I have 3 children and 3 grandchildren, end of story. But I think it is important. I felt safe with the surgeon who was doing this delicate surgery. I felt safe with the resident that was assisting him because I knew that these people cared about me. And, they weren't African American, but I felt that Dr. Stephen Ori, who was a specialist in women's problems, had the experience behind him, had the care behind him. I'm still in communication with this doctor even today. Every year, I send him a newsletter and a picture of my family, my kids, and now I have grandchildren. And I think it is important to have that confidence in the person who is going to be working on you. No one wants someone who is nonchalant about your care, who has no empathy, who has no feelings, who doesn't really care. You are just a number and an insurance payment for these people. When you find a doctor who is in your corner, even if the news is bad, you have confidence and trust that this person is going to be by your side, even when you're going through a painful circumstance and maybe even a painful outcome. You feel that this person has done their best.
Yes.
Yeah, definitely. Well, I've of course got my surgeon story.
We're just a mess.
I know, yeah, the old lady thing, start talking about all your ailments and your surgeries. But but this was right after I had Zakia, right after I had given birth. I think maybe because she was born in November, and I think I went into the hospital for surgery in, I think it was February. And what happened was I was in intense pain. And I called the doctor because I think, Barbara, you had recommended me to your doctor, because I'd had a black male doctor who delivered my child, and he did good. I mean, he did, Dr. Odie Payne. He was good. But there is a difference having a female doctor.
Yes.
There's a difference.
Yes.
And I understand men who may feel like they prefer a male doctor, because you kind of feel like people understand your body parts better when they have them, as opposed to these in school,
As opposed to reading about them in a book.
Yeah, I want you to have what I have so you can feel what I'm feeling, So I actually had, like I said, 2-month-old baby. And my husband and I were wondering if we were pregnant. I love how couples say we and ain't but one of us.
Yeah, exactly.
Maybe we were pregnant.
Yes.
Because I hadn't had a cycle start again. And I know there's the process of, before your cycle starts, but the thought was maybe, and my mother-in-law kept saying, you probably got a burst tubal pregnancy. And I'm like, no.
Stop.
I don't even, and sure enough, got to the hospital and they examined me, got the ultrasound and everything. And they found I had a fibroid tumor on one side and a tubal pregnancy on the other side that had burst.
Yep.
Which, if they don't remove it, could be fatal.
Yes.
So they said to me, okay, now you realize you're not going home today, right? No, we're going to have to operate. And then they pull out these forms, which
say, yes, you can die.
If you die, it ain't our fault. You can't sue.
Yes.
You got to sign that. Otherwise, we're not going to do the operation. So that was interesting. I mean, it's not like you have an option. You must. And I get it, because doctors are doing the best they can. If every time a patient dies, they got to face a lawsuit, is that really fair? Because
that's why the insurance is so high.
Yeah. So I understand. I mean, it's like, okay, we're going to do the best we can, but if you die, oh, well, at least, we tried. So I get that. So I signed the forms, of course. And, it is interesting when you are facing a possible end of life situations and you start thinking, okay, if I don't come out of this, who's going to take care of my child that I just had, and I start thinking about all that stuff. Then I decided, okay, I'm just going to expect to come out of it. And luckily I did. And when I woke up, our father and my husband was standing there. They're both standing there smiling and happy. So that was a nice image to awaken to. So I'm like, okay, I guess I did make it.
Yes.
And they had to staple my stomach back together. I've never seen that before.
Yeah. I remember the staples.
Yeah. So, now they probably got Velcro. I don't know.
No, they actually do they actually do glue. They actually do glue, because for my hip, because I've got about a 6-inch scar
Mhm.
and they stitch it from inside out almost, so
Mm.
that your scar isn't as bad. And for a long time I had these, like, looked like two little on each end there was a long, looked like a piece of floss, and they just last week
Mm.
cut those off, because the way they do it, they stitch it from the outside and then they glue it so that you won't have, because a lot of black people have keloids.
Yeah.
Yeah.
And so they do that, so I shouldn't have that much of a scar. But it's a hip surgery, and where that scar is, ain't a whole lot of people gonna see it anyway.
Yeah. So I mean, you don't really worry about it.
Well, it's fine. But it's interesting that you said, that you have this thing, and this is what people need to understand when you go in, is that they will give you a form right before you go under, saying,
Yeah, as if you're
okay,
gonna say, "Nah."
if you don't come back, don't hold
It's
on.
on you.
Yeah.
And
Not
the
our
thing
fault.
is that, Sarah just recently had to have some surgery, and they give that to her right before. And that kind of freaks you out. And I had forgotten to tell her about that. But the more you get to know about what the procedures are, the
Mhm.
better equipped you will. Even if you know what you're allergic to, what,
Yeah.
especially pain medication, how
Yeah.
much pain medication you're going to be given. And a lot of times people, and this is true, they have tended to under medicate black people,
Yeah.
even
Now,
children.
I have read that because they
Even
act like
children.
black people don't have
They
pain
don't they
like
don't think
everyone
they
else
have
does. They
pain.
don't treat you the same.
and
Yes, they don't.
sometimes we'll feel like, well, I don't want to be a sissy or whatever they call people
No,
who
Yes,
no.
yes,
It is
exactly.
important to be
cry.
willing to say that you're in pain and to take the medication, because being in pain raises your blood pressure.
Yeah,
And
and
your
it makes
stress
it hard for
level
your
and
body
your
to heal.
cortisol and
Yeah.
everything else. And that is very interesting, because when I had my myomectomy, I remember, Barbara, you and Lavinia came, and there was 12 hours that I
Mm.
went without any pain medication.
That
And I
is so
remember
wrong.
calling Barbara and saying, okay, I don't know what's going on, but I must be being a baby, because I'm really in a lot of pain. And one of the surgeons came in, and when she found out that I had gone that long, she says, no, you're not. You're supposed to be getting something every 2 or 3 hours, not
Yeah.
every
And
12
just
hours.
suffering for a whole
And that is the thing. And then I had another surgery, because, like I said, I've had several, where they had stretched it out to every 6 hours. And I talked to the nurse and I said, you know, I am in pain, and I want you to start understanding. The nurse was a black woman, and I said, I want you to start noticing what the surgeons recommend for pain for black people as opposed to white people.
Ooh.
Because I says, now that you know, I want you to notice, because sometimes they stretch it out a little bit more. And there was a time, and I didn't even have surgery for this, but I crushed two
Mm.
fingertips on a weight. And the doctor didn't want, or the resident did not want to give me pain medication,
Ooh.
because he said I was going to start to crave it. So a lot of times when people, and this is a crush injury, so
Mm.
there's a lot of inherent racism
Yeah.
in our healthcare system. So when you know these things, you need to go in armed. I
Yeah,
mean, go in armed and say, listen,
I'm
when
not
I'm in pain, don't tell me that I don't have pain, or they're not as sensitive and putting in an IV because they think our skin is rougher. And there are some of
Mhm.
these things that are still in medical books. And those are the reasons
No.
why the health outcomes aren't as good for Black people. Now, I did want to read a little bit of this. This comes from ABC News, and
Mhm.
I'm not gonna read the whole thing because it's a long story.
Well, cite where people can pull this up themselves on
Okay,
video.
yeah, you can go on, you know what? You can go on a link on abcnews.com, and the headline is, more Black physicians could improve life expectancy of Black patients. And this comes from researchers, and I've seen this before. This was also mentioned on Pod Save the People, which is a Black podcast that I listen
Mm.
to. It's
Mhm.
from the Crooked Media. I highly recommend Pod Save the People. And this was one of their stories also. And they've had other stories that have come out that have said this, other researchers that have come out. This starts, I'm going to say this really quickly. Weeks of shoulder pain landed a reluctant Whitney Nichols in urgent care. As a previously healthy 24-year-old Black woman, she pleaded for additional testing to uncover the cause of her pain. As a last resort, the doctor ordered a CT scan of her chest. The result, blood clots in both her lungs. Even after the seemingly scary diagnosis and after being transferred to a hospital, Nichols said she felt dismissed when a doctor told her she would be fine. Nichols, now 29 and a graduating medical student, reflected that these interactions with dismissive doctors made her feel so alone in that space and unsafe. But Nichols said that night, everything changed when a Black physician, Dr. Erica Walker, walked into the room. Walker explained the blood clots were serious but treatable. Walker advised Nichols to stop taking her estrogen-based birth control, which can increase the risk of blood clots, and prescribed medications that would break up the clots. She said it was great just seeing somebody that I felt like I could be comfortable with. And that's just one of the stories. And they just said, Michael Dill, the director of workforce studies at the Association of American Medical Colleges team, analyzed the relationship of Black primary care physicians and the health outcome of the people who lived in those same areas, evaluating 1,600 U.S. counties. Dill and his colleagues found that a 10% increase in Black primary care doctor representation was associated with an extra month of life expectancy for Black patients.
Wow.
Higher the representation of Black physicians in the workforce per county was associated less death of any cause for county residents, Black and white patients. Thus, even people not actively being treated by Black physicians benefited from their presence, like the results published in the Journal of American Medical Association in April of 2023. So, what's good for us is good for everyone.
Yes.
Yes.
That is incredible, the fact that these studies are available to people, but the fact that there is still such a prejudicial look at people of color who need to go in for treatment. I mean, the fact that this person is going to say, well, I'm afraid you're going to become addicted if I treat you.
Yes, yes.
Don't say that to everybody.
No, they don't. And that's one thing. They seem to think you're drug seeking, and I had a crush injury.
Right.
And that's the thing, is I was in so much pain. They actually, because I was engaged at the time, and they had to cut my engagement ring off because I had sausage fingers. And it was just so terrible. And I just thought, okay, this is a person, and it was, right here in my neighborhood. And I think this is a person who is dealing with lower socioeconomic people, and they are treated differently.
Which is so bad.
That is the thing.
It's a mindset you have to get rid of in every industry. Every industry has to get rid of the mindset that first you decide a person's worth based on their income or where they live or what language they speak. All of that has to be done away with, because all of it is wrong. But now when it comes to pain medication, I remember after my surgery, I was hooked up to a
morphine
drip, and they wanted me to keep, and I press a button and you
press the button,
and they wanted me to keep pressing the button, and I thought, I don't want to get addicted to morphine. I'm not pressing the button every few minutes.
There's only a certain amount that you get anyway.
Yeah,
I can't take morphine myself. I'm allergic.
Yeah, but, I just decided that I don't remember being in pain, and there might have been a little bit of discomfort, but I just decided I didn't want to get addicted to morphine. And then you get out of the hospital, you ain't gonna get no more. So
but morphine,
unless you know a dealer down the street.
I did, but I could have got some street drugs. But I just decided I didn't want my body to become needing I didn't want to
But
become addicted. I didn't
okay,
want to be
let me
dependent
tell
on
you this though. Let me tell you this though, as someone who just recently had surgery, and they do give you opioids. They gave me Dilaudid because
that.
I'm allergic to a lot of other things,
Yeah.
and I tended to like try to get rid of it. And they said, okay, if you have that first week, like, okay, if you run out, let me know, And I said, there's no way I'm going to run out. I'm taking like one a day. And then the rest of it was Tylenol, extra strength Tylenol. And they said and my physical therapist says, listen, people tend to under medicate now because when it's opioids, people are so afraid of getting addicted, and
Right.
so people tend to under medicate. And what happens though is that you become stressed. And there were some times that I was really uncomfortable. I'd wake up in the middle of the night and I was in what I would call pain. And then I would say, oh, are you just sore? Is this pain? Is it, and I'm trying to figure this out. But I said, okay, but you have to take something because it's interfering with your sleeping and it's interfering with your healing.
Yeah.
So understand that you need to be without pain in order to heal. And
Right.
you also, which
Yeah.
means you have to advocate for yourself,
You do.
because sometimes, because of systemic racism, you will get someone who says, oh, you don't need that, or just do that. Now for me, because I just said, okay, I'm going to take as little as I can to get through it. And of course you can't drive that unless you've been off of it for 72 hours. So I just said, okay, at this point I'm just going to use the Tylenol and the anti-inflammatory and that kind of stuff. But like I said, I was also very lucky, and I healed better than I thought. Thank you, Dr. Phillips. But I'm going to shout out this man forever. But I also had to take care of advocating for when I was in pain, because they want you to be comfortable enough, but not to take so much so that you can kind of push yourself to do things that you can't because you're not feeling any pain, because that's when you injure yourself. So
Right.
it's a little bit of a balancing act. But the most important thing is to understand and talk to your physician and your surgeon. How much discomfort am I going to be in? Because some people, when they have surgery, they think they're going to be up and running around in a day or two. That's usually not true. And usually, if they say 6 weeks recovery, you're not all 100% in 6 weeks. It may take 8 weeks or 12 weeks, but know that going in so that you don't think that you're behind the 8 ball and that you're doing something wrong or that you're a bad patient.
Right.
Everybody heals differently.
That's important to know. Everybody.
It's important to know your own body, because
Yes.
sometimes you'll be injured and not recognize it because you're not used to being on the lookout for it.
Absolutely. But you should not be in pain. That's the signal your body's giving you that you have to do something.
Yes.
So that the pain goes away. But we've got to go. But number one is advocate for yourself. Do not sit and suffer. Don't be in pain.
Find a doctor who is your advocate for you.
Absolutely. And
Yes.
if they're not, find somebody.
Find someone who
We got to go. But make sure you like and subscribe to our YouTube channel, 3 Black Moms, and like us on Facebook, 3 Black Moms. And we will see you next time. Until next week, I'm Naima.
I'm Cheryl.
I'm Barbara. We are 3 Black Moms. Hi, I'm Barbara.
I'm Cheryl.
And I'm Naima. We're 3 Black Moms.